Hi there, I'm Nancy Nash with Starfish Strength. Long before I became a trainer, I unfortunately experienced lots of injuries and setbacks, and I still deal with aches and pains from them today. I want to share with you how to effectively use heat and cold therapy so you can keep moving and feeling your best. And at the end, I'll talk about a couple of my favorite things to use for heat and cold therapy. So let's start with cold therapy. So let's just say you were going for a walk and you sprained your ankle, or you were lifting and you pulled your shoulder. Ice is really effective at treating acute injuries like that. Using cold therapy will help to immediately reduce swelling and pain, especially if you do it in the first 72 hours. And if you're able to elevate the injured area while you're icing it, even better. So let's go back a second and talk about what I just said about acute injuries. In this video, we're going to talk about two different kinds of injuries, acute and chronic. So an acute injury is something that happens to me in the moment. It is something like a sprain or a break. Now, tendonitis can be an acute injury. It is possible to stress the tendon all of a sudden. But usually something like tendonitis or bursitis is something we're dealing with over a period of time. So we treat it as a chronic injury. So really the only difference in how I would use cold therapy for an acute injury and a chronic injury is frequency. So if I've had an acute injury, then I'm going to use it more frequently. Whereas if I have a chronic injury, I'm probably just going to use it after prolonged exercise or movement or another reason that I had a flare-up. And remembering that injuries that have swelling are the ones that I really want to think about using cold therapy for. So cold therapy is going to immediately reduce swelling and inflammation. So for an acute injury, I would use cold therapy for 15 to 20 minutes every 2 to 3 hours for that first 72-hour period. For something that's a chronic injury and just flares up once in a while, I would still do a spurt of 15 to 20 minutes, but I would not do it that frequently. I would really just do it after prolonged exercise, even if the area does not feel inflamed, because it will help it recover faster. Like let's say that I had a knee sprain a couple months ago and it's been feeling pretty good on my runs, but I went for a longer or a faster run today. After my run, that would be a great time to do some cold therapy because I'm going to help my body recover quicker. And I'm still remembering that even though I don't have swelling, that tissue still does have some damage that was done to it that it's recovering from. You also don't have to have an injury to benefit from cold therapy. After I go for a run or a bike ride or a hike, and it did test my body a little bit more than it usually does, that might be a great time for me to take a cold shower or sit in a cold tub of water and ice my hips, knees, and ankles so that I recover faster. And going hand in hand with this, ice is really effective in treating sciatic flare-up. Now, it's not the only thing you should be doing to treat your sciatic flare-up. Make sure you're making the muscles strong around that sciatic nerve, the ones that are not spasming, the glutes, the abs, so that you're not experiencing that flare-up quite as frequently. But if you are experiencing sciatic pain, if you can lay on your back on a reasonably firm but cushioned surface like a couch or your mattress, and elevate your feet so you bring your back to a neutral position, put the ice on your lower back area and do that for about 15 to 20 minutes. And you should notice your sciatic pain goes away actually pretty quickly. So I know I've said cold therapy and ice, I've used them interchangeably and often people do, but I do want to define you can make it too cold. It is possible to ice something and give it frostbite, even with the best of intentions. So for best practice, never apply ice directly to skin. Even if I'm putting ice in a Ziploc bag, I want to wrap it in a thin towel, maybe make sure I have a piece of clothing between the ice and my skin. Chemical cold packs are really common and really helpful because they're not going to get quite as cold as ice will, as frozen water. So ideally, if you can use something that's about 33 degrees Fahrenheit and 0.5 degrees Celsius, that's pretty ideal for the body. And you can probably use that safely up to 30 minutes if you need to. And again, I would do 15 to 20 minutes, but if you have an acute injury or just some serious pain, you might want to do it a little bit longer. So just like cold therapy, heat therapy can be used for both acute, sudden, or chronic ongoing injuries. If you have an acute injury, it's a general recommendation to wait about 72 hours after the injury to start using heat therapy. And the reason really is that you want that inflammation and swelling to be greatly reduced. And heat therapy is going to promote blood flow. Right before exercise, that's a great thing. I'm warming up the muscles and the surrounding tissues, getting them ready for movement. So the way I most commonly suggest heat therapy is really when the body is cold. So first thing in the morning, before I start my day and go into my first client appointment, one of the first things I do is a little bit of foam rolling to warm up the body, get the blood flowing, get the tissues warm. And then I like to use a microwaveable bed buddy or other friend and put it on an area that tends to get stiff. So I have a shoulder that I've injured twice. I have a foot that I've broken twice in a similar spot. So these are really old injuries, but they are things that I still feel some of the effects from. And as much mobility work as I do, I know that a way I can prevent myself from getting injured is to make sure that those areas are properly warmed up. So starting with heat therapy and then going to foam rolling and then going to stretching and then going into heavy lifting is my ideal formula. Now, if I feel like I had a really hard workout and that area is feeling, particularly taxed, I might do cold therapy at the end. So that's kind of how they can work together. Other times that you might want to use heat therapy are at the end of the day. So I generally take a pretty warm shower at the end of the day, obviously to wash and cleanse myself, but also to get my muscles warmed up so that I can do some evening stretching. I can try to bring things into better alignment so I will feel better, sleep better, and wake up moving better throughout the morning and the rest of my day. Heat therapy can also help us relax. That is the other reason that I like using it at night. I actually take a warm shower, I do my stretch, and then I heat up my buddies in the microwave and I put them anywhere on my body that doesn't feel relaxed. Sometimes for me, because I'm on my feet all the time, it's my calves actually. Sometimes it is that old shoulder injury, or sometimes it's my hips. Or let's say your neck and shoulders are just really feeling sore at the end of the day. It depends on what I've been doing that day, but like a nice mug of tea at night, it can really help you sleep better. So if you're someone that struggled with sleep because of body pain as I have, it's worth giving it a try. Now, sometimes people don't exercise because they are having cramping in their muscles. Doing heat therapy before you start any sort of exercise in that sort of circumstance can really help. I had a client that was working through some really difficult muscle spasms in her bicep after a really extensive shoulder surgery, and she had to be immobilized for a long time. So we always did heat therapy and gentle massage and foam rolling first. And I know it can take a little while to do that whole warm-up process, but you really will get such greater range of motion in your exercises and start recovering so much more quickly because you can go through that range of motion. So definitely, if you're struggling with a chronic injury and your doctor's cleared you to work out, make sure that they have, try heat therapy before your workout. And just like an injury, some of us have really severe menstrual cramping during that part of the month. And even though a lot of us know that exercise can help make that better, the motivation is really, really low. So when I have bad cramping in that area, I also use heat therapy for my menstrual cramps and then slowly start getting my core and my hips warmed up. If you're feeling really cramped up, try applying some heat, try some gentle exercise, and let me know how you feel. So I want to talk just for a moment about moist heat versus dry heat. So a lot of products on the market will talk about how they provide moist heat. The benefit basically is that moist heat penetrates deeper tissue faster than dry heat. So you're going to get relief that much quicker. So you're going to see improved circulation, improved mobility, decreased pain, and essentially just help your body heal a lot faster. Or if you're using it at night to get to sleep a lot faster. So just like cold therapy, I'd recommend doing heat therapy for 15 to 20 minutes and maybe 30 minutes at the most. So using your microwavable buddies is great for enforcing that time limit because eventually they're going to get cooler. Now you can use, an electric heating blanket, but you definitely don't want to use that overnight. You could also use a hot water bottle or a hot compress. And if you do something like a hot bath or a shower, your ideal temperature is going to be between 92 and 100 degrees Fahrenheit or 33 and 37.7 degrees Celsius. So when you're heating things in the microwave, many of those products won't get too hot, but just make sure that when you put it on your skin, it feels pretty good. And if it feels too warm to you, err on the side of caution. Do what we said with cold therapy. Put a towel right between your heated compress and your skin. So for cold therapy, you could literally, as we said, use a bag of ice with a towel wrapped around it. Or you could even use something like a frozen bag of peas. I'm sure you've heard that before, but I'm not trying to waste your frozen peas. If you want something that you can reuse, that's where you might want to consider some kind of a Velcro compress that maybe also works like a brace for a period of time, or just something that you can strap on different areas of your body. So this is one that I got actually when I had that shoulder injury years and years ago. And I have found it useful for so many different things, including bumping your head, which hopefully doesn't happen to you. But there are a number of different ways you can use the Velcro strap to wrap it around your body. And then it has a reusable, refreezable pack that doesn't get too cold. And it does stay cold for, I think, longer than 30 minutes. So I have used it for other acute and chronic injuries. So for heat therapy, I recommend the Bed Buddy, or Rice Sock as I've affectionately known it, as to everybody because it's very versatile, it's very affordable, and you can set yourself up with a couple of them. Say, you have a sore chest after you've been doing some bench pressing, or you have sore hips after running, or your feet are just feeling really cold in the morning. So there are a whole variety of ways you can use it to help yourself with conditions from arthritis to neuropathy to an acute or chronic condition. And then really recently, I've gotten to know the menstruation crustaceans. In addition to being cute and smelling like lavender, the shapes of them are kind of conducive to certain areas of the body. So this one in particular, I think is really helpful if you do get inflammation in your hips, or you actually do want to deal with menstrual cramps and warm that area up before you're exercising. So another fun option there. None of the products I'm suggesting in this video are sponsored. They're actually things that I really use. I will leave links to them in the description. Thanks so much for checking out this video. I hope you learned something that helps you improve the way you're feeling and moving on a regular basis. If you have a specific injury or area of limitation that you want to talk through one-on-one, please reach out to me in the link in the description. And if you're looking for stretching, rolling, or other techniques to help you recover faster, please check out the rest of my YouTube channel. In the meantime, I look forward to continuing this journey with you, and I'll see you in the next video. Testing. Are we coming loud and clear? Coming in loud and clear? Yeah, you're not too loud today.